What are your names and what are your positions at the health unit?
My name is Lisa. My pronouns are she and her, and I'm a social determinants of health nurse at the health unit in planning and evaluation.
I'm Mo. My pronouns are she, her, and I'm a public health nurse in the sexual health program as well as harm reduction.
Great. Now tell me about yourselves. What are your educational backgrounds and what are your professional backgrounds?
Well, I did my Bachelor of Science of Nursing, and then I went on to do my Bachelor of Education, PJ, Primary Junior, and I did my Master's of Arts in Education with my thesis on arts-based approaches to inclusive classrooms.
Before my Bachelor of Science in Nursing, I completed a diploma in biotechnology, given my interest in the sciences.
And what brought you both into public health?
Oh gosh, well, after nursing, I really wasn't sure if clinical was the right thing for me. I knew I loved nursing, but I wasn't quite at home in hospitals or long-term care. So I ended up going back to school for education. And after my master's, by that time I knew I really loved working in collaboration. I loved working in teams, community wellness, inclusive education. I just wasn't sure how all that would fit together. And I ended up working as a casual immunizer for the H1N1 pandemic. And I discovered public health and I was like, oh my gosh, these are kind of a blend of all the things that I really love.
I was fortunate enough to do my preceptorship in the Vaccine Preventable Diseases program, and I know I had enjoyed communicable disease control placement as well. And so I was also fortunately hired into public health after I graduated, and I've been here ever since.
That's fantastic. Can you both explain your current positions at the health unit?
Well, I'm one of two social determinants of health nurses at the health unit. So we work on a great team and we get to do things like support equitable kind of planning at the organization, evaluation and research projects. And health equity is really at the heart of public health. It's what so many of us live and do. And so in our role, we get to work on committees and projects with other staff and with community partners on, to really learn from and increase access to health and well-being, particularly among groups impacted by inequities. So for example, in my role right now, I'm part of a committee looking to make our health unit a safer space for 2S LGBTQ plus folks, doing health promotion stuff related to syphilis and monkeypox, and with partners facilitating COVID clinics for individuals who are at risk for homelessness. So it's always something new.
I can agree to that in public health. Well, currently my position on the sexual health and harm reduction team at the health unit involves a bit of a mixed bag, which I enjoy. So aside from working in the clinic and also working in our needle syringe program, I also lead some community partner type initiatives on the topic of harm reduction and needle syringe programs.
Yeah, that's great. And can you explain to us what the planning and evaluation team does and what the sexual health team does at the health unit?
Ooh, well, the planning and evaluation team is really there to support the fabulous work that the rest of the staff is doing at the health unit. So we get to be part of, like I said before, supporting planning, making sure that people have the data they need to plan, collecting data, analyzing it, sharing it, mapping out things that we want to learn about our community, doing research project, making sure we're kind of following ethical standards with research, and evaluating the impact of our projects. In other words, kind of helping people make sure that did we make the change that we wanted to make with that program.
In our clinic, our sexual health clinic, we offer contraceptives or birth control, testing and follow-up treatment and counseling for sexually transmitted infections, as well as HIV and other bloodborne infections. Our other parts of our role involve gender identity. We, in our needle syringe program, offer safer substance use supplies for individuals who use substances, with an aim to ensure we're providing people with what is needed to use safely, as well as to provide that connection in the community should they be seeking other health and social support services.
That's also important work. And what different roles exist within each of your programs?
I get to work with some pretty smart cookies. I work with 2 epidemiologists, a research and evaluation analyst, 2 research assistants, a program administrative assistant, another social determinants of health nurse, and then our manager, who is an evaluation guru. We also get to work really closely with our incredible communications program and our quality assurance program too.
I work with a fabulous team of public health nurses, program administrative assistants, and we all share roles involved with working in the clinic, providing case management of reportable infections, and providing our needle syringe program service in the CI office.
And what is your favorite thing about your roles at the health unit?
I think my favorite thing is just really getting to do work that feels meaningful, and getting to do that with people who have different skill sets than me, perspectives, experiences. You're constantly given permission to grow as a human and as a professional in the health unit. And I just really feel it's just such a cool place to be a part of, and you're really part of something that you feel passionate about, where there's growth and change and contribution.
I feel like I can echo a lot of those things, but I also, personally can say that I love that I am always learning something new, no matter how long I've been here. Work is always interesting. There's always something different to do. It keeps me interested and engaged, and there's always a level of excitement too, and having the opportunity to see the differences that are being made with clients individually, with community partners, and just with the community as a whole.
And we both work as part of a team, right? Which I think we both appreciate, like that you're part of something bigger.
Definitely. Something I remember from doing placements anyways in more clinical settings is there wasn't always the opportunity to get together as a team. The team meeting didn't exist, and that's one thing that I hope we don't take for granted, is that we always get to sit together as a team and celebrate each other, but also solve problems together.
Yeah, good.
And one last question. Can you both give one takeaway that's relevant to your role or program for youth?
I would suggest probably a lot of youth are already kind of doing this, but I would say to maybe really look at your school and your groups that you're a part of, and think about if every kind of group of youth has the opportunity to get the maximum impact and benefit. Do they feel included? Do they feel a sense of belonging and representation? And a great way to do that is really check in with different groups, read, learn, and see, our physical spaces, our posters, our washrooms, representative. Do we present barriers through transportation, the costs of activities, that kind of thing, and really look at that kind of the culture of your space and see if everybody has a chance to belong.
The first thing I thought of when you asked that question was how much we love questions, and that there is no silly question, and we hope that any youth out there that have any questions about sexual health, gender identity, keeping themselves safe in anything that they're partaking in, that they find us to ask those questions of, because we don't need anyone else's permission but yours to talk to you about what you're thinking about or wondering about. And if we can't help provide what you're looking for, we can do our best to send you in the right direction.
Great. Thank you so much, Lisa and Mo.